Hello and welcome to our podcast. And today we're going to be looking at anxiety. Anxiety is probably the biggest mental health problem there is in the world today. And I don't know if you know, but the research shows that only about 20% of people that suffer from anxiety actually do anything about it. And that's a sort of like a worldwide survey. So it's not specific to certain countries or environments and so on. When you're working with people, Abi, do you find that anxiety is the biggest sort of area that you work with?
I think anxiety is the root of most issues, really. So even when people come to me with a phobia or a fear or something else, another label, so to speak, it generally always boils down to anxiety. But I also think that anxiety is a word that's thrown around quite a lot these days, and it's a word that is used quite casually. And I think people kind of get confused between worry and stress and anxiety. You disappeared then.
It's probably quite useful.
I think people get confused about the difference between worry and stress and anxiety, and they are three very different things, although there is a fine line, but we seem to label everything as anxiety nowadays, whereas stress is quite normal. Stress is a normal thing, and worry is quite a normal thing. And I think worry is something that goes on in the mind. Stress is something that's physical. So stress is a physical response, and anxiety is a physical response to the mind. So quite often anxiety, or most of the time, anxiety is caused by the thoughts that you have about something rather than a physical thing in front of you. But yeah, we seem to have people using the word anxiety a lot, particularly in school and with young people. I don't know if you find that, Andrew. It's just a word that seems to be part of people's everyday vocabulary now. And I think a lot of the time it perhaps isn't anxiety as well.
Mm-hmm. Yeah, it's a sort of umbrella term, and especially sort of switched with stress. And I mean, very often stress is a physical manifestation of anxiety, but then can lead to more anxiety. So it's a sort of secular type of thing. But anxiety, in many ways, it shows that you're human. And also you've got an imagination, because anxiety tends to be about the future. As you say, it's about the way that we think, and we think about what's going to happen in the future. Now, it could be just a second in the future, or a minute, or an hour, a week, a month, a year. It doesn't matter, but it tends to be always about the future, and we tend to go, what if? What if they don't like me? What if I get it wrong? What if it doesn't work? What if I fail again? All of those things. And it tends to put a negative spin on things.
People with anxiety as well, you'll find this as well, because it's utterly predictable, are always overthinkers. They overthink everything and overanalyze everything.
Mm-hmm. Yes, and because in one way, you think of one thing, and then, as I say, you then think of the next imaginative thing that happens. Now, a bit of anxiety is actually quite useful, because it does allow us to think and plan. But if you do happen to be overthinking something, then you can go off into all sorts of territory that is not at all helpful. And it can really be a big disability in what we want to do in life. So anxiety, it just reminds me that if we say to people, oh, don't worry about it, or get a grip, it's all in your head type of idea. Well, that's one, not at all helpful, because it can just generate more anxiety. But secondly, it's all in your head has a truth about it, but it has a real effect on people.
And it's all well and good saying that kind of thing to somebody, but actually, if they could just switch it off, if they knew how to do that, they would have done that already. And so yeah, it's not a helpful thing, is it?
No. And like you said, if you can tone it down, you won't switch off anxiety as such, because it's one of those primeval type of mechanisms that we have for our health and well-being, especially when in the sort of prehistoric times, caveman times, whatever it was, that it helped you to be on the lookout for danger and anticipate. But if it's used now, or anxiety now, as you say, can be overworked, overspun, over thought, which then becomes a bit like self-harm in a way. And we just sort of spiral down into it, and it sort of stops us from doing things.
Well, like you say, it's a normal human emotion, and it's an important one. And I think people a lot of the time think about emotions as in positive emotions and negative emotions. Well, actually, there's no such thing really as a negative emotion. They're all important. And people think that good mental health is about never feeling those emotions that they don't like, that are a bit uncomfortable. But that's not true. Good mental health is about not being overwhelmed by them.
Yes.
And being able to take some control of them, or manage those feelings, isn't it? It's not about never feeling stressed or angry or upset about things. You have to feel those things. It's part of being a human being, and it's important that you recognize those emotions. It's when you become completely overwhelmed, or they're there when they don't need to be, that's when it becomes a bit more of an issue.
Yeah, that's right. It's about managing. Because actually, if you didn't have any anxiety at all, you're probably dead. But it is about managing it, and it's about
and regulating it as well, isn't it? It's about if you understand your emotions and you can recognize them, then you'll be much more able to regulate them, and that's the bit that's important. And when it comes to poor mental health, or people struggling with symptoms of mental health, it's quite often about not being able to regulate them, and not feeling in control of them. And that's certainly for me the biggest thing that my clients struggle with, because they feel like they have these feelings that just come from nowhere, that overwhelm them, and that they can't do anything about, and they sort of seep into areas of their life where they don't really need to be, or actually they're really unhelpful. So teaching clients to understand and be okay with emotions and feelings is one of the important things that we do, and teaching them how to regulate them and how to use them in a more helpful way.
Yeah, and that is really important, that people should recognize and understand that you can help, and we can help, and they can help themselves. And I think it was very important that you mentioned the fact that there's no such thing as a good or a bad emotion. It's effectively how we work with it. And if you do think that an emotion is bad or good, and you feeling down or low or unhappy or angry about something, that can generate more anxiety if you think you're being bad.
Well, and it brings up a bigger feeling, because you try and work harder to avoid feeling like that, and that either creates more anxiety because you're trying to avoid a certain thing so that you don't have to feel uncomfortable about it, or you lower your self-esteem because you feel you shouldn't feel like that, and your self-esteem goes downhill a little bit alongside it.
Yes, and by and large, anxiety is often seen as a function of self-esteem, and I suppose you could say there's two basic types of anxiety. There's sort of general, which is sometimes called general anxiety disorder, GAD, which is just being effectively being anxious about lots of different things. And then there's specific anxieties, which, without going into too much detail, are often called phobias.
Well, things like health anxiety is one that I've seen quite a lot of over, especially with COVID. Health anxiety has really become a big one. But yeah, it's something specific, isn't it?
Mm-hmm. But when you get to the sort of foundation of them, they tend to be the same thing. It's just the way that we think and how we control that thing and going, what if?
It's about interpretation, isn't it? It's about how we interpret and view and the perspective we have about something or everything. So It might be something specific, or it might be just everything, how we view the world around us, or other people, or even the weather, or objects. There's all sorts of things we could be anxious about.
Yeah, and it's interesting because the more anxious we are about things, the more anxious we tend to become about things, and we can get stuck. And if this goes on for a long period of time, that's when the so-called anxiety disorders come about. I was just thinking about somebody I was talking to the other day, and that they'd come to see me for anxiety and negativity. And the whole of this discussion was all about them saying, well, they didn't think anything that we did would work. And I'm trying to discuss about how things do work, etc. But it was a real interesting exercise, just to see how that mindset just has a continual little loop in its thinking. And of course, we've talked about confirmation bias in the past and cognitive bias and so on. That all plays in here because the old, what is it, the Henry Ford thing, if you believe you can, and if you believe you can't, you can't. Well, if you become anxious about something, then sort of physiologically, the way that you think becomes much narrower. So therefore, you're not thinking as creatively. So if you're anxious about something, the chances are that there might be a mistake. It might not work the way you want it to. And then your confirmation bias kicks in and says, see, I told you I couldn't do it. And you're right.
It just becomes a self-perpetuating cycle then, doesn't it?
Yeah.
And I think one of the frustrating things that I find as well, I don't know about you, is the sort of beliefs we have as a society now about anxiety, because lots of people believe that it's something that's wrong with them, or that it's a fixed part of who they are, and that it can't be changed, that they've either got to be medicated for it, or they've just got to learn to live with it, or find a way of just coping with it in their life. And that's just not true, is it?
No, indeed. And in fact, there's basically three types of treatment, if you want to call it that, for anxiety. There is the medication, this area. There's the talking therapies, and there's lifestyle changes. And yeah, you can get a combination of them, but I think more and more now, people are realizing that it's the thing that will help most to help people regulate their anxiety or reduce it is the talking therapies. Now, of course, there are times when people are so anxious about something that they might need some form of medication to get them to a stage where they can actually do the talking therapy. But
Yeah.
I think a lot of the research shows that, in effect, the relapse rate after being on medication, if you're just solely on medication, is quite high.
Yeah.
Because actually the underlying type of anxiety is not really gone away. You're effectively masking it.
Yeah, it kind of tricks you into making you feel better, because quite often it's giving you a happy hormone, so to speak, isn't it? So it can kind of either numb that feeling or cover that feeling up. Mm-hmm. But people tend to end up increasing their dose, or being on it for a very long time, because actually it doesn't fix the underlying problem. Yeah. It doesn't change your patterns of thinking, and that's really what it boils down to, isn't it? It's the patterns of thinking that you have and the habits of thinking that you have that create anxiety. You have to have those thoughts to create feelings in the first place, and the more feelings you have, the more thoughts you have, and it just becomes a big cycle. So you've got to break the cycle at some point and learn how to change your thoughts in order to change the feelings, and that it's a skill.
Yes.
It's a skill, and it's something that anybody can learn to do if you've got somebody to show you how. But it also takes practice, and I think a lot of the time, you were talking earlier about not many people seeking help, and I think that's because a lot of the time either people feel almost a bit comforted by their anxiety. Sometimes they feel like it's a comfort zone and they know where they're at with themselves, or they don't want to change. They think that getting rid of that will change the person that they are. And that can be scary for a lot of people. That can be a scary idea for a lot of people. Or it is something that's got to be worked at. And I think people find the idea of having to put the effort in and put some work in to be a scary idea. But it's just like being unfit or overweight. If you want to get fit and healthy, everybody knows how to do that. We're well educated on how to be fit and healthy. We eat healthy foods, we go to the gym, we do some exercise. It's the doing that is quite often the problem. We know intellectually what we need to do, but it's the doing. And it's the same with anxiety. You know, you can have somebody tell you what to do and how to fix it, but actually ultimately it's the doing part that's going to make those changes. But anybody can be rid of their anxiety if you're prepared to work for it a little bit.
Yeah, it's really interesting, the fact that people worry about not being able to put the effort in to overcome their anxiety, take control. But just consider the amount of effort they do to keep themselves in that anxious state. Now, I've been anxious in my life. We all have. And sometimes it's been worse than others. And that takes an enormous amount of effort, both mentally and physically, because being anxious and being acutely anxious is really physically tiring. So it's just being able, again, to flip that idea. The other thing that's important is that in terms of working with anxiety, the medical aspect is often seen as something being done to you. It's an external thing. So it's I mean, obviously it's taking a pill, but and that the pill does the bit.
Fixing. Well, and people want fixing as well, don't they? People want their anxiety fixed.
Yeah, but it's the talking therapy, the CBT, the hypnotherapy, all of these things, the applied positive psychology type stuff, that actually help the person to feel empowered and they feel in control. And that's why the studies show that these things, I can't think of the word, what's the word when you come back to doing what you did before?
Relapse? No.
Anyway, you're much more likely to be in control, to have reduced and controlled your anxiety after doing talking therapies, and then you are if you've just done medication. And they're very often used in combination and so on, because everybody's slightly different and can get different help. But it's the talking therapies. Plus, it gives people the tools to help them, that they're not relying on anybody else. If they were to feel a bit anxious in the future, or stressed or worried or whatever it is in the future, they know they have the tools to be able to do it themselves. So they're not relying on the pills, which very often have side effects or and things like that.
And just to say as well that there are, even within talking therapy, there's lots of different kinds of therapies that suit different people, isn't there? Because you and me both do apply positive psychology and hypnotherapy, and different things work for different people. So even for people that have tried to tackle their anxiety through a talking therapy, that might be listening to this thinking, well, I've tried that, it didn't work. Mm-hmm. It's always worth trying something different, because there is a way. You just need to find the one that works for you.
Yeah, and that's a very true thing. The other area is some practical, which I suppose you could call lifestyle skills, ranging. The easiest thing to do to help with anxiety is something that we do all the time, and that is breathe. But the odd thing is, you have to practice. Now, you might say, well, I breathe all the time. But yeah, to help with specifically if you feel you're becoming anxious or stressed or worried, and I'm intermingling all these things together. And I don't want somebody to write to me and say, well, there's this technical difference and there's this sort of technical difference. You can write to me, but I do know that. But the breathing is nature's way of helping reduce anxiety. I mean, if you think of it, if you've ever had to go and do an interview, or you're going to a meeting, or do something that you're not looking forward to doing, just before you ring the bell, or you open the door to the room, or you start to do that task, you take a deep breath, a deeper breath than you would normally do. And you do that automatically. And what it does is it lowers the anxiety, because you're getting more oxygen to the brain. Well, we can do that by practicing, and just practice breathing. And there's lots of different techniques for breathing. So what I'm going to do is just sort of say a general way of breathing, and you can adapt it to yourself. Now, and basically it is to take a deep breath in and fill your lungs, and then just hold it, and then slowly breathe out. And the key to it is the breathing out is longer than the breathing in. And there's some evidence that if you use pursed lips, sort of like that, as you breathe out, that it affects various parts of your brain quicker, and it can just come down. But whatever works for you. And if you're not quite sure, if you can't remember breathing in slower, but breathing out even slower, just count. So you breathe in for the count of 3, you hold it for the count of 4, and you breathe out for the count of 5. So that would sort of go 1, 2, 3, then hold 1, 2, 3, 4, and breathe out 1, 2, 3, 4, 5. And you do that 2 or 3 or 4 times, and you practice it every day, maybe morning and evening, so that when or if a situation comes that you suddenly start to feel anxious or worried, or you're talking to somebody and you get imposter syndrome or something like that, you can start to think about the breathing and just kick in because you practiced it. If you haven't practiced it, what happens is it goes out of your mind if you start to get anxious. So it's like anything. If you think of the job that you have, or you think of something you do regularly, it's because you practice it that it can kick in automatically if things aren't going quite as well as you want. So just practice the breathing. And you can do that anywhere. You can do that on the bus. You can do it in the car. You can do it sitting down. You do it in bed, whatever, just to practice that breathing.
And that's a brilliant coping strategy, isn't it, for when you are feeling stressed or anxious? It's something to sort of bring you back down in the moment. My tip really, and again it's something that we do all the time, a bit like breathing, is actually listen to your thoughts. I think a lot of people who struggle with anxiety try and ignore their thoughts. They try and pretend that they're not there, and they build up and up and up. And actually, I think one of the best things you can do is listen to your thoughts so that you can catch the unhelpful ones early and challenge them, swap them for something more helpful. Ask yourself how factual they are, how much evidence you've got. Can you swap that unhelpful thought for something more helpful and just try and play it down a bit more rather than catastrophizing and making it into a bigger problem and letting it spiral? So listen to your thoughts more, try and catch unhelpful ones and swap them for something more helpful or realistic would be a tip that I would give.
It's a bit like putting your thoughts on trial. You can say, well, what's the evidence for that? And just because you've had a thought doesn't mean it's real. We've talked about this. It doesn't mean it's real. It doesn't mean it's the truth, though it might have a real effect. But it's just your opinion. It's just a thought. And your opinions are coloured by your confirmation bias and just the general beliefs that you have, your perception.
Yeah. Thoughts are not the same as facts. Thoughts are not, just because you think something doesn't make it true. And actually, as brilliant as brains are, they're really clever and complex things. In some ways, they're really simple as well. Your brain is quite a lazy thing. It takes a lot of energy to run your brain, and therefore your whole brain is designed to make quick judgments and snap assumptions. And it does things to make life easier for itself. And one of the things that it does do is never assume that it's wrong. So it's your job to make it question that sometimes, and just question that thought and just question if it could be wrong. It makes quite a big difference.
It does. And again, even doing that, and if you come down on the side that actually that thought is correct, by just doing that, you've sort of taken control of it. It in itself lowers the anxiety because you feel that you don't feel as helpless or as hopeless as you might do.
Perspective as well. You've probably gained a much more helpful perspective, which will instantly make you feel more in control. Because a lot of anxiety as well is about that feeling of being out of control, isn't it? For most of my clients, it's the lack of control that creates their anxiety in the first place. Yes.
Or the perception they have no control.
Yeah.
Because obviously there are lots of things in life that we have no control over. So in a way, they don't really matter because we have no control over them. But we do have control of how we respond, how we react to those things. So we have a sense of control. And that comes down to what you were talking about, asking about the actual thought.
Yeah. But I mean, there's lots of other aspects to anxiety that we work with, isn't there? There's lots of pieces to the puzzle, so to speak, because we don't just talk about thoughts and feelings. We talk about self-esteem. We talk about other people, interpretations, beliefs, imagination. We talk about lots of things when we work with clients. So it's quite hard to give a full roundup of anxiety today just in a podcast. But I think I think it's important really just to note that anxiety is not something that you have to just put up with and have to live with or learn to cope with. It's not something that's wrong with you. You're not broken, and it is absolutely something that you can overcome and take control of.
Yes, that's very true. And actually, a lot of people don't necessarily recognize that it's anxiety that may be causing them issues and difficulties, because as we know, the way that we think about things can affect us physically. So I said earlier, there's only about 20% of people that suffer from forms of anxiety that go to get any sort of treatment. But a lot more people go to try and treat the physical manifestation of it, whatever it might be, the upset stomach, the headaches, the all of those sorts of things. And it's maybe then that they find out it's actually anxiety that's the issue. Or maybe not, or maybe they go down a long line of various treatments for headaches and this, that, and the other, and looking at blood pressure, etc., etc. And when it comes down, actually, it might just be anxiety that's manifesting itself that way.
From personal experience as well, I suffered with anxiety for a long time before I trained and did the job that I do now. And I had no idea that I was anxious for a very, very long time. I used to just get these awful stomach aches. I was diagnosed with IBS, irritable bowel syndrome. I used to get headaches. There was something else. What else did I have? It was IBS, and I had the odd panic attack as well. But I think people with panic attacks generally know that that's anxiety based. But certainly stomach aches. Certainly headaches are quite common. Teeth grinding is another one that I see from clients. It's a quite common one. But yeah, lots of stomach related issues are anxiety based, aren't they, or stress based?
Yes.
Sleep is the other one.
The other one.
I did not sleep. So I was given medication for irritable bowel syndrome and sleeping tablets, and nobody ever pointed out to me that it was probably stress or anxiety based.
Yeah.
I thought it was a medical issue, and I learned to live with that for quite a long time and just took my medication.
I think that about 95% of all things that are diagnosed as IBS are down to sort of anxiety, stress.
Yeah, they are. And I think that's quite often not pointed out to people either. They're diagnosed with IBS, but they're not, or I certainly was never told that it was because of my stress. And if I dealt with stress, then the problem would go away. And it did. I haven't struggled with that for over 5 years now. It's been a long, long time since I've had any kind of stomach issues. But nobody told me, the obvious as it is, that if I dealt with the stress and anxiety, that I wouldn't have these stomach aches anymore. And I'd sleep much better. And neither of those things are an issue for me. And I see the same thing in my clients time and time again. You know, they stop having panic attacks. Their teeth improve. They stop having headaches or migraines because they're not anxious anymore. And I think the other thing, especially people with anxiety struggle with, is not being brilliant at something straight away. They kind of think, oh, well, if I'm struggling to calm my thoughts down, then I mustn't be very good at it, so I'm not going to bother trying again. But actually, you can't learn any skill without failing a few times first. You know, I think we've talked about this before, but no baby learns to walk by just getting up and walking along and never falling over, nor do they fall over and think, oh, I can't do that, I'm not doing it again. You have to practice and persevere, not for a very long time, only really for a couple of 3 weeks. If you practice and persevere the skills for 2 or 3 weeks, then they start to become second nature and they start to become habits, whether that's the breathing technique that you talked about, or the way that we talk to clients about listening to those thoughts and challenging them, or building self-esteem. It's just about practicing skills and embedding them in your everyday, isn't it?
Yeah, and challenges. We talk to our clients about challenging themselves to just push against their comfort zones, and so
only tiny bits at a time.
Yeah, tiny steps. If you try to, whereas you just take the tiny steps and you get there.
Well, and also, if you do something that's too challenging and too difficult, you're likely to create more anxiety and feel more helpless about something, and that bias going, oh, it was too hard, I knew I couldn't do it, we'll kick back in again. Mm-hmm. So it's definitely better to take small baby steps towards something rather than try and jump head first in and fail.
Yeah, no, that's right. And it was it Confucius that said the journey of 1,000 miles requires the first step?
I've no idea. I've heard the quote, but I don't know who said it.
Well, I think it was. But yeah, basically, you do need to take the first step, and then the second, then the third, then the fourth. And
it's never as scary as you think, and that boils down to asking for help as well, or seeking help for your anxiety, doesn't it?
That's just a very short interlude in our podcast about anxiety generally. And I think if you just remember that you can do something if you want to about it to help. Anyway, thanks very much. And we look forward to seeing you or hearing from you next time. And I'll say bye. Bye.
Yep. See you next time. Bye.